While Congresswoman Giffords is making great strides in her recovery, these next several days are crucial. For a look at that, we turn to Dr. David Langer. He's a neurosurgeon at North Shore University Hospital in New York. Dr. Langer, thanks for being with us. Is it really hard for you to imagine, in the capacity of serving as a doctor and neurosurgeon, that we're looking at Congresswoman Giffords today, not only still alive, but making remarkable progress?
I'm not sure if it's certainly remarkable progress. I think that the most critical thing was that she was alive and had function when she arrived at the hospital, and that really was the set piece for the rest of her possibility of recovery. And I think it's just obviously just a terrific story and a great medical story of all the resource that went into her care and really how wonderfully she's doing. So yes, it's remarkable in that the system worked. She's obviously a high-profile person, and there couldn't be a better person for the system to work on, and so I'm sure everyone's very grateful for that.
And some people are indeed calling it miraculous. But let's talk about the details of her injury. We're learning today that they may remove the breathing tube. What does that signify?
Well, basically, when you have a trauma such as this, the care is really divided into portions and pieces. The very initial step is the acute trauma and the triage and management, which was the surgery and the decision-making surrounding that. And right now, she's really in the intensive care unit phase, and removal of the breathing tube is simply almost like a step in the process. The next step is to remove the breathing tube, to see how she breathes on her own before then, and then basically start to assess her neurological function so she can go to the next step, which is rehabilitation. We've
learned that she can move her arms and her legs in these next few days, as you mentioned, are very crucial. What are they looking for? What are they trying to determine?
Well, I think there's really, neurologically, I think her injury is more or less fixed at this point. It's not going to be very variable. Really, it's her brain that will more or less recover on its own. So what they're really looking for is really an assessment of what her deficits are and what kind of rehabilitation in particular she's going to need, whether she'll need physical therapy, whether she'll need speech therapy, occupational therapy to learn how to use her hands again. So each of these functions will determine the intensity of those types of therapy that will be offered to her.
And very quickly, I was learning that it really depends on whether she's left-brain or right-handed or left-handed to determine how much of, I guess, damage perhaps her brain has sustained. Is that true?
Well, it's a little more complicated than that, but the truth is if about 99% of right-handed people are left brain dominant, which means that what that means really is that when we think of dominance, we mean speech. That the vast majority of right-handed people are left brain dominant. Left-handed people tend to be a little bit more complex. They often can have bilateral speech or right-sided speech. The truth is, I don't know if Ms. Giffords is left or right-handed, but we don't know what her speech function will be or her dominance until we really
kind of connected.
Right, we really need to assess her when she gets extubated.
A little ways to go still. Dr. Langer, though, we do appreciate your insight and breaking it down for us. We do appreciate that.
Thanks for having me.